Hello, my name is Mackenzie Rain Lockwood, and I'm from Marquette, Michigan, United States. I'm an electrologist, and I'm here for surgeries. I've always known I've been transgender since my earliest years. I never fit in with the boys and didn't quite fit in with the girls. They always didn't know where to put me. So I always felt kind of out of place. As I grew up and got older, the kids, when they found out about me, bullied me, picked on me. I felt I fit in with the girls, but the girls didn't feel I fit in with them. So I was kind of an outcast, a little bit of a loner. As the years got on and I got in my later years of school, it got worse, and the bullying turned into beatings, and it got worse and worse. And I got so depressed. I didn't know what to do about this. I was always alone. And I always felt I was a woman, but everybody saw a boy. Eventually, I felt like not living anymore. I didn't know there was something to do about this, some way to change my outside appearance to the way I felt inside. So I searched on the internet. At first I found nothing. I went to my local hospital and I told them my problem. And they actually laughed at me and mocked me. At one point I tried to commit suicide. 3 times actually. I kept searching on the internet and I came across a few things that I could possibly. There was Douglas Osterhout, who was the first person who would do these surgeries to feminize your face. And I thought, maybe there's hope for me. So I looked and looked and looked. Douglas Osterhout is no longer practicing. Where to go? So I did a lot of searching online, and there were companies in the United States that one would do some procedures, others would do other procedures. The prices were so high without me having insurance. There's no way I could afford it. It cost way too much money for me. So I looked and looked again. I did a Google search and I came across JaneMED. JaneMEd is in India. So I thought, well, I'll give it a shot. It's a long ways away. I went to JaneMED and I found a live chat link. So I thought I would ask questions. I did not see live chat on other links. And I pushed hello, and almost instantly I got a reply. And I asked questions. Do they do transgender work? What are costs? Where are you at? I got my questions answered very quickly. The prices are much, much better because of our exchange rate is so good. I can get top quality work for a much better price. So after getting my questions answered, I was very impressed that I could get an online consultation fairly quickly with a very well-rated surgeon, many years experience. And I spoke with the surgeon, and he answered all my questions. He told me pros and cons of different procedures, did not try to pressure me to go one or another, and made it easy for me to decide which procedure I needed and how it would work and how my recovery would go. So I talked again to Myra at JaneMED, and I said, this all sounds really good, but I'm a little afraid to go by myself to a foreign country. I'm a little afraid I'll have a language barrier. I won't know how to get around. I'll be lost. What do I do? Myra explained that she will pick me up at the airport and she will take me to our place to stay, and transportation is supplied, food is supplied, drugs are supplied, everything you need, everything is supplied. So no worries, I don't have to worry about speaking language, transfer monies, it's all taken care of. So I said, well, I'm still a little scared to go by myself. Can I bring somebody with me? Yes, I can bring my girlfriend with me and she can stay with me. And that made me feel so much better. So we booked our flights and we came to India. I got to the airport, I went through customs. I thought there would be an issue at the airport with language, but most everybody at the desk at the airport speak English. So this was not a problem. I was able to navigate airport customs, security, no problems. And when I got my baggage, I messaged Myra at JaneMED and I said, I'm done, I'm ready to go, where are you? And she messaged back right away, I'm looking at you through the window. So I'm looking, and there she is. So I went out and met her, and Myra gave me a big hug, and we went out and had coffee and we discussed everything. So after a nice long talk and getting to know each other and having coffee, we packed up in the car and we headed to our room. So we're going into town for our pre-surgical testing. Everything we need to know to find out if I'm fit to go through the surgery in downtown Mumbai. Here I'm going for my pre-surgery consultation to get all my final questions answered before surgery and make sure that I want to do what I said I wanted to do.
The tissue is raw, so you leave it open, it's just going to shut down. So you need to have a line which prevents that passage from shutting down and keeps it padded. Okay? So
the surgeon answered all of my questions. He went over all the procedures once again to make sure that the one I chose is still the one that I wanted. And I did. So on our way for testing, Myra, my sister, went with me, and my girlfriend Denise on my other side is with me. And we are taking a nice scenic ride through Mumbai. Here I'm taking all the testing, blood pressure, checking my heart, doing blood work, and everything else you normally do before major surgery. Here we're going for testing of my heart to make sure that my heart is in good enough condition for major surgery. You can see all the instruments they use I don't totally understand, but they said I was good to go. Since we had a little time to kill waiting for tests, we went to one of the local malls, which are they're huge, and we got to see a few of the shops, which I really want to go back and do some more shopping. And you can see that they're just gigantic, all kinds of stores, and really interesting stuff that I just don't get back home. We found this really neat little jewelry shop that had some cute little ankle bracelets, and we bought some of these. They're all almost pure silver, and I can't find anything like them at home, so we just had to get a few. We were all getting a little bit hungry, and I found this little IHOP in the mall, and it has some Western food, and I thought that would be the perfect thing. So I went there and had some pancakes and some Western food, a little something coffee and a little bit sweet, and just enjoyed some time. After all of our testing, we were headed back to the clinic to see the surgeon for final consultation, where the surgeon would tell me exactly how the surgery was going to go, what they were going to do, and what I should expect. When you do a skin graft, it somehow gets its blood.
yes, and that is the same way the jejunum is supposed to be. Okay?
I am Kenzie Lockwood. I am going for my GRS surgery shortly. I'm a little nervous, a little excited, and we'll see how this goes. so glad Myra and Raj are here with me. I would not want to be here alone. I'm nervous. You see what blood I've got?
Bring it down with its blood supply. Now that will happen only if you have a long enough, what we call a pedicle, that is the length of the
Yes.
blood vessel.
I understand.
If the blood vessel is short, it's not going to reach there.
Then it's a graft.
So then it's a graft. If it is reaching there, then it is brought down. So now you have a pouch. The top end is being.
You have little rooftops on top of the tall buildings.
And okay, so we also provide a relative meal for international patients. So would you like to have one?
Yeah, but
What
no,
is
I'll
this?
go out and I'll eat it.
I should send this to my grandson who smokes a little. He'll want to get one. Just went for my antibacterial scrub, getting ready for surgery. Oh, time for the circus to begin, right?
Yeah.
I'm so glad I had Myra here to help me. Every time I needed something, she was right there. I never had to wait. She was right there. She is amazing. After my vaginoplasty surgery, I had some pretty bad headaches, and Myra massaged my scalp and really got rid of all my headaches. And it was so comfortable. So this is a donut pillow. It takes all the pressure off your surgical area for vaginoplasty and makes sitting far more comfortable. Highly recommend this. The first few days I just lazed around at home and drank a lot of coffee and kicked back and enjoyed myself. So we got a chance to go around and see the sights and do some shopping. And I took a little video here and there and saw some interesting things. Myra's Beauty Salon.
Myra beauty salon बोलती है.
Hi, I'm Kenzie. 3 weeks ago, I had Jejunum, GRS, or gender reassignment surgery. Jejunum is a part of the small intestine, which we use to create the channel for the vagina. I have to dilate right now 3 to 4 times a day, which will decrease over time. These are the dilators that were provided by JaneMED. Comes in different sizes. So we start out with the small and progress up to the larger. I'll start out with the small and then work up as high as I can go. Right now, after 11 days, I'm on number 3 of 5. But I'll start out with this one and work my way up like 5 minutes, 10 minutes, and minimum 15 or more at full depth with this one. Now there's coconut oil, 100% pure coconut oil. This is what my surgeon recommends to use. Or you can use KY jelly, works very well as well. But this one is all natural and he says it's the one to use. So there are different types of dilating. There's static dilation, which is inserting, and there is dynamic dilation, which could be in and out, or also a stirring motion, which helps open up the inside tissues. You need to stretch beyond the diameter of the dilator. So, dilating was hard for me. It's getting easier as I go on. It slowly stretches. But the best way for me so far I've learned to do this You lay in a bed, bend your knees, and I just take a deep breath and I just tell yourself to relax. You start out with the loop dilator and start going in. It's going to feel like it doesn't want to go at all. Use really, really slow movement, at least for me. And if you use gentle pressure and steady pressure, eventually it goes. And I'll do a combination of in and out and stirring motion. It will pull the tissue apart gradually. You don't ever go fast. Don't do anything fast with these. So you want to get to full depth. And I time every one. For the small one, I just do, since I've done it, I'm up to third now, the small one I'll start 5 minutes at full depth, and I will do like a stirring motion to help open it up for the next bigger size. Then I'll do the next one for 10 to 15 minutes, and the next one, like this is what I'm on right now. You always want to do full depth. If you don't do the full depth, you will lose that depth. So make sure full depth. And you want full depth, minimum 15 minutes straight. You can go longer, I often do. I generally go a little longer, but no less than 15 minutes. If you do short, you're gonna pay in the long run because the tissue around the opening, the pressure, the tissue wants to close in like it wants to heal, and you need to push it open. One of the things I also do while I'm in at full depth is Kegel exercises while the dilator is in at full depth. What a Kegel exercise is, they're the muscles that you use if you want to stop peeing midstream, okay? And you clamp that muscle down around this, and it will help pull the tissue apart, push it away from the opening. And I just do that like I was doing a regular Kegel exercise. And I'll do that a number of times during my 15 minutes, half an hour, whatever I decide to do. I'm not sure how long it's going to take me to get to the next size, but it does not look like a big step. But going from here to here, this is hard. We'll see how long it takes. 11 days I got to here. This one, I don't know. On this one, I have no idea. So that's what I've learned so far. Hope this helps. So we're on our way to another consultation with my surgeon. Looks like Myra's already had a long day, and she has. We're going to see about a second breast augmentation, a revision on GRS, and also lower lip augmentation and fixing a crack in my nose. Well, you can see I'm standing during our consultation, and that's because I recently had GRS, and sitting isn't really much of an option at this point without a special pillow. These are different size breast implants to get an idea of what I want to do. And so we tried a few on to see if I could figure out just what size I wanted to end up as. And here we're just doing some routine checks to make sure I'm ready for surgery and make sure everything's looking good. Hello, I'm Kenzie. I'm here at the hospital and I'm finishing up my vaginoplasty and getting breast augmentation, a little bit of lower lip work, and fixing my broken nose. And then I'll be all finished. Happy to be done. And here we go into surgery. So surgery all went very well, and I'm getting my final checks here, and after 2 days, I get discharged and I'm going home. Hi, my name is Kenzie. I am 10 days post-op from my breast augmentation procedure. I initially had a B cup, small B cup, and about 1.5 years ago, I went to 500 cc, high profile, over the muscle. I wanted to go more, but there wasn't really quite enough tissue. So I waited 1.5 years, and then I came back to JaneMED, and I now have 645 cc, high profile, over the muscle. And this is, I think, about perfect. I like it. How it was for me, it was a little more painful, a little longer than the first procedure, mainly because these implants are a little bit wider than my ribs, and it's wanting to pull the tissue away from the sides. So that's a bit painful. Overall, it's really not so bad. I took some help getting out of bed for a few days because when I lift up, it kind of hurts here, but it's been 10 days. The pain is almost entirely gone, and I expect I'll be lifting things soon. Finally, after 10 days, starting to get comfortable to walk around without being in pain. It wasn't excruciating pain, but I tended to walk like this quite a bit, holding the pressure off of the stitches. If I do that, I was okay. Nothing was excruciating, wasn't too bad. Over the muscle is less painful and a quicker recovery than under the muscle. I have over the muscle. Cannot tell you what under is, but I hear it hurts more. I'm very happy with it. It's perfect size. I don't want to go any bigger. It's going to stay where I'm at now. It'll be a good day at the beach. As you can see, I've got a bit of a fat lip going on here. I'll explain what happened. I had a lip, my top lip was slightly bigger than my bottom, and I wanted my bottom lip to be slightly bigger than my top. Most people would just get injections and plump their lip up, but that goes away in 6 months. I was looking for a permanent solution, so I consulted with my plastic surgeon, and I told him about a conversation I had with Douglas Osterhood, who is a famous plastic surgeon. Oh God, 30 years ago I had this conversation. And I asked him, how do you get bigger lip to a more feminized lip? And he said what he does, he cuts inside the lip and rolls the lip out slightly. And then he does a loose stitch inside. And that will leave more of a lip, you know, for lipstick, whatever. And you can adjust the size of the lip, any size that you want. And on top of that, we injected fat into the lip. It looks really, you know, too big now, and that's the way it's supposed to be, because 2/3 of the fat that was injected will reabsorb by the body. And I've done this a few times. This is the 3rd time. So, you know, if 2/3 gets absorbed, 1, 2, 3 times should get you the level you want. So when this settles down and heals up, will be about 3 months from now, the results should look quite nice and slightly bigger than my top lip. And it should look very nice and even by then. So you can see the stitches in my mouth where it was cut. Pain level is not too bad. You have to use a mouth rinse every time after you eat to keep it clean. The stitches will self-dissolve in time. So until it's all healed up, mouth rinse probably for at least a week and keep the area clean. And takes about 3 months for the final result. So it's been 8 days since I've had this done. It's already starting to go down significantly. So when it's all settled, I'm gonna send some more pictures and you'll see what it looks like. Here I'm going in for my post-op check with my surgeon and also to get some Botox. So what Botox does, it keeps you from being able to contract a muscle for about 6 months. So if you get it up where you're having a wrinkle or a crease in your eyes, your forehead, you will not be able to contract that muscle for about 6 months. And it helps keep you from squinting and getting new wrinkles. So my surgeon said everything in surgery went just fine. My jejunum vaginoplasty is looking very good. Very pleased with it. Breast augmentation went very well, along with work on my nose and augmentation to my lower lip. And here I'm getting some letters written up by my surgeon, one for the airline, so I can hopefully get a more comfortable place to sit after my SRS, and also for my back to work schedule for my job. And finally, after we're done, we're here at McDonald's to get my addiction, coffee. So this is what I waited for as my highlight of the day. So here we're riding the metro train in India. The metro is relatively new here, and God, what a nice way to travel. It's high up above the highway. You see everything. It's not crowded, it's smooth, and perfect way to get around.